Hello and welcome to the latest SDI podcast. Today, Dr. Linda Greenwall will talk about the latest advancements in whitening technology from SDI, featuring Pola Light and Pola for aligners. Linda is a renowned world authority on tooth whitening and aesthetic dentistry. She runs a multidisciplinary private practice in London, specialising in restorative dentistry and prosthodontics. SDI Pola Light is an advanced tooth whitening system combining Pola's award-winning whitening formula with an LED mouthpiece that adopts special blue and red light technology to accelerate the whitening procedure. Pola for aligners is SDI's latest innovation. Using Pola Night 10% carbamide peroxide gel, this new technique enables whitening and aligner treatment to be undertaken concurrently, ensuring great results with no additional wear time for patients. Let's hear Linda's views on both of these products. You've been using the Pola whitening system for many years. How has Pola Light fitted into your patient's whitening journey?
Well, it's a very exciting development to have the Pola Light. It gives some new options for patients who were struggling with the bleaching trays before. And it's a fun little exercise to undertake.
What's been the feedback from patients?
Patients like it. Basically the Pola Light is a starter whitening. So if they've struggled with whitening before, or they've have never used whitening and they don't want to use the custom-made trays, then it's a nice option as a starter.
Is demand for at-home top-ups coming from patients themselves, or is it usually based on your recommendation?
The thing is that the rules in the UK are very strict. It has to be first assessment by a dentist to see if it's appropriate, and then the dentist has to agree. So they can't just randomly top up when they want to. It should be a course of treatment, first assessed, to check that there's no pathology and that it's suitable for whitening. We would assess a patient carefully and assess their whitening at every stage when they're in with the hygienist. So in our experience, we would only top them up 3 years after doing the initial whitening with the trays, because the home trays are still the best way to whiten your teeth, to get the most effective whitening, to get into the bleaching potential of the tooth. And then you really get a lot of whitening because you have better contact time with the trays overnight. That's the best way. So this way, it's a short, quick fix for the time being, but they will need to continue to top up because they're only doing 10 or 15 minutes as opposed to 10 hours overnight. There's a big difference, but it's a good starter and it's a good for a top up, which is great.
As the Pola brand continues to keep pace with dental innovation, SDI has now launched Pola for aligners. What are your first thoughts about this addition to the range?
Congratulations to SDI, because they always got their finger on the pulse. And this is a very fast growing industry. Many patients are choosing to wear aligners to align their teeth. And this is such a natural to help them with the whitening.
At what stage of a case would you recommend using Pola for aligners?
So my recommendation is normally first start the aligners. After a month, when everything is settled down, then you can start your whitening straight away in the aligners. But wait a month for everything to settle down. Not really at the end of treatment, because patients, luckily for this one, patients always want everything yesterday. They want everything fast. But in terms of the whiteness, they would do 1 month to let everything settle down. So not at the end of the treatment, but really at the beginning of the treatment. And then they can start to get the benefits of the white teeth now. In terms of dentists, they need to assess their patients, take a radiograph to check what the nerves and the roots of the upper front teeth, lower front teeth, to check that. And then, as I said, once the patient's got used to wearing aligners, then it's a great thing. I was teaching on Friday a whole group of dentists who are using aligners, and we explained how they would use the whitening in the aligners. And this is a really effective way to do things.
Are there any limitations to using the products? For instance, if attachments are being used?
You've got attachments. The whitening goes underneath the attachment, so the attachment don't interfere with that at all. As long as you do the whitening for long enough, you'll get very effective results. Goes through the tooth, under the tooth, in the tooth, all around the tooth, and it will whiten underneath where the button is placed. We do know that when you have braces and when you move teeth, you can get little bits of micro bleeding inside the tooth. So the tooth can go a little bit more yellow during any alignment, such as braces or aligning. And so that's why it's good to just get the whitening underway.
Thanks to Linda for her time today. These are certainly new innovations that patients will love. If you would like more information about Pola Light or Pola for aligners, please visit sdipola.co.uk.